Hi, my name is Ghajar. I'm a neurosurgeon, founder of the Brain Trauma Foundation, and also NeuroSync. As founder and president of the Brain Trauma Foundation, we do the national guidelines for traumatic brain injury. And when those best practice guidelines are put into place, the death rates drop by 50%, and the outcome of patients with traumatic brain injury has improved a lot. One of the issues in traumatic brain injury is mild traumatic brain injury, concussion, and we're funded by Department of Defense. Not only do guidelines for people with severe traumatic brain injury, but also for mild. And we were asked to define the condition. And unfortunately, it's like 32 different definitions for mild traumatic brain injury. And so we went into it in depth and found evidence to support subtypes. There are certain things that people with concussions have that are common, and we call them subtypes, and we can measure them, and we also can correct them. And a lot of them have to do with attention. So when somebody gets a concussion, what happens is they have attention problems. They can't pay attention. They're at risk for injury and risk for not only head injury, but other kinds of injuries, and can't perform. And so those attention metrics we took and funded by Department of Defense. We did large clinical trials using eye movements to look at how well we can measure attention. Now, eye movements are very particular because everything has to land on your fovea, the back of your eye. You put your thumb out, all you can see is your thumbnail, and that's all you can really process. Your brain can process. It can't process the whole world at once. So when it starts to move, your brain has to pay attention and predict where it's going to be. That prediction and attention can be measured very accurately, very quickly, and it's a measure of attention. And attention is really inhibitory control, which I know a lot of you are there at the conference for juveniles and individuals who are in the justice system. And a lot of those individuals have trouble with inhibitory control or paying attention, and may lead often to their circumstances. And so we've been measuring it over 100,000 individuals. We did large clinical trials of children and adults, concussion, ADHD, sleep deprivation, and each one of those had a signal in the eye movement so you can pick up and measure how well people are paying attention within 30 seconds. A very quick test, very accurate, very reproducible. And the good news is it's treatable. When people have trouble with inhibitory control, you can train them to improve that. And so I'm really happy that you all are meeting and discussing this. And I think in the future, we'll be able to measure individuals in the justice system to see if they have these problems and try and correct them. So thank you.